Hi, Joe. Thank you for joining us today.
Thank you for having me, Rebecca.
We really appreciate your time. I know
Sure.
you're a very busy guy working for the government. So
Happy to join you tonight. Thank you for having me.
so tell me what year did you graduate from Fresno State and how did you end up there?
Sure. So I graduated. So I actually graduated a few times from Fresno State. I got my undergraduate degree in 2006, and then I got my MPH in 2008. And I ended up actually at Fresno State. I was actually originally from the Bay Area. I was born in Santa Clara, California. And my parents, I'm the third of three children in my family. And my parents had actually decided to relocate to the Central Valley and to go back to school. My mom had a cousin in Selma, California, who had encouraged her to come down with her family. And so my parents relocated. And so then a little later, they had signed up for college at Fresno State. And they were a little bit older, and but decided to pursue going back to college was the option for them. And so with them came myself and my two siblings, and in the mid-90s they finished. They both graduated. My mom actually graduated with a master's and in early childhood education, and then my dad ended up doing it in business administration. And then my brother followed, and he also graduated from Fresno State in business. And then he also went on to become a nurse and all kinds of, an MBA from the Sid Craig School of Business, and he's actually a lawyer in Fresno. My sister, same, she graduated with a bachelor's degree in health administration, and then went on get her master's in health informatics. And then myself, I was the last of the three to finish, and I got my undergraduate and master's of public health at Fresno State. So it was kind of a family affair. I was the fifth person to go through it in my family. So by the time I graduated, you go through, you become an expert at Joyle, and you're signing up for FAFSAs and learning the classes to take and study hard and write papers and become an expert at Cal State Fresno.
Yes, we all know how that goes for sure.
You
So
bet.
did your dad get his master's or his bachelor's?
So he just got his bachelor's just in business administration. And then that was all. He was the only one, actually, in my family that doesn't have a master's. It's a good point.
Well, your dad's a veteran, right?
Yes, he is. Yeah, my dad served in the Air Force. He was a surveyor for the Air Force, and he was stationed different places in the United States. But the biggest thing that he did was really cool. He did surveying down at Edwards Air Force Base for the space shuttle. But that was back in like the 1970s, before I was even born. But really, it was really cool. He still has the drawings, actually, I think, in the garage back home in Fresno. But yeah.
Oh, that's awesome. Do you go home a lot to visit?
I try to when I'm able. My duties are sometimes it's tough to kind of get out of the DC area and get back home, but I at least try to get home at least for the Christmas and Thanksgiving holidays. It's always great to be home for the holidays.
So what is your role in DC? What are you doing right now?
Sure. So currently, so I'm an industrial hygienist. Most of my career, I have been an IH or an industrial hygienist, but I work for the Department of Energy in kind of a unique role as an industrial hygienist. We actually, where I work for, it's a group called the Office of Worker Safety and Health Policy. And so we, in a sense, I am an industrial hygienist, but it's really allowing me to kind of use my master's degree with health policy and management to review different types of policy aspects within the federal government. Our office actually covers four main policies within the Department of Energy's, and it's actually not just limited to the DOE, but it's called the Code of Federal Regulations, and it's codified versions of the law that are divided. I believe there's 50 chapters of the CFRs. They abbreviate it, but we cover four different programs. 10 CFR 707, which deals with workplace substance abuse programs at DOE sites. There's 10 CFR 835 that deals with the occupational radiation protection program. 10 CFR 850 that deals with the chronic beryllium disease prevention program, and 10 CFR 851, which is the worker safety and health program. And all four of those regulatory requirements kind of go in greater in depth, but it's an arm of public health in the energy sector that ensures kind of above and beyond a safe and healthful work environment for different aspects that energy comes from. So it was really kind of an interesting and opportunity to get a chance to even do it. But yeah, the DOE, it's amazing the different federal agencies, the public health opportunities that are out there for people.
So you've been working in government since you graduated college, correct?
Yeah, that is correct. I graduated from Fresno State in 2008. And I've jumped around in different federal agencies for the federal government, but I'm in my 13th year. It's been a great career. I've seen a lot of things, but currently right now, that's kind of the policy aspect of what I've done. But I've seen a lot of other arms of public health, mostly as an industrial hygienist, but a few other experiences, both in the it's kind of made more of like an environment. Is it appropriate for me to kind of go in depth, maybe of some of the things that I've done?
Sure, absolutely. Please do.
Okay. Yeah. Well, yeah, I guess I'll start from when I graduated, so you students and other viewers can kind of see where I started. So when I graduated, I had actually applied through the university. It was a federal career intern program, or it was called FSIP, and it was offered actually through an arm of the university's career service program. And I was lucky enough to apply and get an interview and got in. And I was a consumer safety inspector for the U.S. Department of Agriculture. And that role is kind of both maybe an environmental and a community health role, in the sense that you're providing regulatory compliance for the consumer. You're making sure that products that the USDA inspects, the arm of USDA that I was with was primarily the meat, poultry, and egg industries, but they cover other products as well. That are like thermally processed, i.e. canned or jarred goods. There's actually even an establishment in the Central Valley that actually makes baby food that actually I used to have to visit frequent. Fresno State actually even has an establishment on campus. I didn't know that until I started working for them. And it's actually tied to I think they're called the Gibson Farm Market, where they actually sell different crops, but they also sell meat, poultry, and egg products, and they're actually some of the best quality that are in the valley. One of my favorite ones was really kind of neat. They would make it during like the Easter time and other times of the year too. But they actually would make like hams, but they would actually mold them in the shape of like footballs, like a pigskin, So real popular actually around the Easter holiday season. People can go to the farm market and get it. I unfortunately never did go buy one, but I hear from what I was told, because the students would run the meats lab is what it's called, but they would go really fast, and they would kind of go back and forth between the meats lab or the farm market. Agriculture's humongous at Fresno State, but it's really quite good. And some of the product was just, man, it's amazing. It's just high quality stuff. So anyway, so I did that for about 2 years, more or less. And then after that, I'd seen an opportunity with the VA, the Department of Veteran Affairs, of the VA Veterans Hospital System, and Fresno, and applied and lucked out and got it. And I was their industrial hygienist and GEMS coordinator. And what that means, GEMS, is Green Environmental Management Systems. Deals with environmental management, hazardous waste, hazardous materials, and industrial hygiene, ensuring that people are safe on the job with different hazardous processes. So an example could be maybe like in a hospital pathology lab, they use formalin, which is like a preservative. Like if let's say you go to the doctor or the dermatologist and they find something that's peculiar on your arm, like a mole or a growth or something, who knows? So they take a biopsy of that and then they put it in a jar of formalin. So OSHA has a rule. It's called the formaldehyde standard, and formalin is a form of formaldehyde that you have to evaluate to make sure people aren't overexposed to that. It's called a PEL, a permissible exposure limit, or PEL. It's a federal legal limit of how much a person can get exposed to that in a daily shift, typically 8 hours. There's a little bit more to it. It goes more in depth, but doing that type of air sampling for that, ventilation evaluation, working with different aspects of the hospital, working with clinical staff, respiratory protection. That's a big thing right now, obviously, with COVID-19. But in a healthcare setting, definitely even more concerning because you have nurses, you have physicians, you have nurse practitioners, you have radiology technicians, on and on and on. And you have to make sure that staff have the appropriate protection so that they don't contract tuberculosis or SARS or Japanese encephalitis or some horrible other disease. And there's different type of, in a sense, face respirators, which is different than face coverings, to protect people against that, particularly healthcare workers. And so I ran that program for several years at the VA, and on and on and on and on. It was a one place I would say, though, for public health students or professionals, the VA is a phenomenal place to work. They also partner with UCSF, at least in the Fresno VA. So they also have many student physicians. It's a teaching hospital. And the opportunity just to kind of learn how that works, it's really quite an endeavor, and you learn so much, or rather I did, but I could see students doing so many different type of public health opportunities within the VA, or the Veterans Health Administration system. Really, really quite great. Sorry, I kind of took a lot of time talking about the VA.
Okay, that's good to know. That's really interesting. That's good to know.
Oh, there is.
Yeah.
There is. And actually down the road, I guess as the interview concludes, I will talk about a couple of different student programs that actually, one of them is actually geared entirely at the VA, and there's many opportunities that recent graduates or soon to be graduates should definitely consider if they're interested in working for the federal government, and definitely for the VA.
But that's
after that,
here in Fresno, is it? It's just, it could be elsewhere.
All over the world.
Mm-hmm.
A lot of people don't realize the VA actually has, well, they did at one time, they actually have clinics. They currently have one in a foreign country, actually in the Philippines. People don't really, in Manila, which is the capital city of the Philippines. They used to actually have a clinic, from what I was told. I've never seen this, but a colleague of mine that I worked with at the VA San Francisco had shared with me that at one time they used to actually have a clinic in Paris, France, which I thought, wow, that'd be a great place to work, right? But don't get me wrong, there are other opportunities to work abroad for the federal government. I'm not sure about the VA, but definitely the State Department, the Department of Defense, which is probably one of the largest departments in the federal government, and on and on and on. Many other agencies. Anyway, but a lot of my career was with the VA, so I also, later in my career, I also worked for a regional office within the VA, and the way the VA is categorized up, it's actually in this, they're in, I guess you could say like a regional office, but they have an acronym for them called VISN, and it stands for Veterans Integrated Systems Network, or VISN, VISN. And at one time there was 23 VISNs across the United States with different states cut up into it. On the VA's website, I believe it's still there. There has been some reorganization of where those boundaries are. For the Fresno area, it's considered VISN 21, and that includes Central and Northern California, Southern and Northern Nevada, Hawaii, and the Philippines, and some Pacific Islands that the Hawaii VA and the Philippines have different community-based clinics, or they call them CBOCs, community-based outpatient clinics on like islands like America, Samoa, Guam, different Hawaiian islands or other territories that are within the Philippines, which is quite an interesting aspect to think about veterans care, that it could be all over the Pacific as well as in the continental United States and Alaska as well. But like I had mentioned later in my career, actually, when I came out to the DC area, I'd actually worked for their VISN office out here, and this was VISN 5. And same aspect, it's just it had a little less. VISN 21, I think, has 8 or 9 facilities. VISN 5, I think we had 6. And so our area out here covered West Virginia, Northern Virginia, the Washington, D.C. area that actually has a hospital in the city in D.C., and Maryland.
So in you mentioned Guam, in Guam?
Yes, in Guam, as well as other aspects of the Pacific. The VA has reaches that are all the way out to Manila and the Philippines, as well as on the other side of the continental United States, all the way up to Maine, Florida, Washington, D.C., and all parts in between. But the VA actually is interesting because it actually has other aspects within the agency itself that also regulates or manages veteran cemeteries. And the closest one to Fresno is actually up in the Los Banos area, as in Santanella, as well as many other locations. They actually have a really great one in Hawaii called Punch Bowl National Cemetery. And they're all geared towards veterans if they have an interest to do that. And they have an entire department called Decedent Affairs that actually allows for veterans to see if they qualify for death benefits. So which is an entirely different process from the healthcare aspect, but a lot of times they're housed in hospitals. So, but it's really it's quite an organized system for veterans healthcare. But it's for many public health professionals. There's many opportunities to work in the healthcare industry, especially with the VA and some other agencies within the federal government as well. So after that, I worked for the Department of Defense down at Naval Air Station Lemoore, and for their naval healthcare system, they call BUMED, or the Bureau of Medicine within the Navy. Very similar to the VA, but the Department of Defense, typically as an industrial hygienist, which is why I was for them, you're in industrial hygiene, but you also kind of deal with more of the entire service of the base. So you see all types of processes and industrial manufacturing, different things that are like secret and top secret, a lot of jet operations for fleet management, dealing with how do they maintain aircraft operations with different type of composite materials, on and on and on and on. It goes really kind of in depth for industrial hygiene and safety, environmental professionals, health administration, health promotion. It's military installations are like cities. They really are. I think Naval Air Station Moore, when I was there, I think they had like 40 or 50,000 people on base. So, I mean, it's probably as big as Selma. I mean, that's a big city, right? I mean, well, for the most part, but there's a lot of aspects to working on military installations and many different type of occupations. So after that, I had the opportunity to wing it to the DC area. Really great experience. The government relocated me. They paid for it all. Had the opportunity to be the national industrial hygienist for United States Department of Agriculture Food Safety Inspection Service, who I was a food inspector for earlier in my career. So that helped quite a lot. I went to 33 states in that job and visited countless meat, poultry, egg establishments that were all over the United States for all varieties of industrial hygiene or ergonomic or health and safety requirements under federal OSHA. Met with federal OSHA many times, met a lot of very, I guess you could say, leadership type of people in the food industry, seen all kinds of things. That was an extremely busy job, but a really helpful job to learn and network and meet so many people in so many aspects of the federal government. And actually I had a really great office in downtown DC where I could see the Capitol building from my window. Oh man, that was something. That really sealed the deal right there. But working with the different agencies within USDA, there's many public health opportunities as well, with them, the whole government really. After that, I worked for them for about 3.5 years, and then moved on to the VISN, the VA, and was with them for a shorter amount of time. And the opportunity came up where I'm currently at with the Department of Energy, and decided to pursue that. And here I am. So.
Wow. So would you, would you change anything about your career? You seem like you loved it. This is awesome.
I don't think so, and I'll tell you why. And I know that probably seems like a lot, and I didn't get a chance probably to go in great depth with every position that I've had. But I'll tell you though, the great thing about, because all of the one thing that all of those jobs have in common is that they all work for the federal government, and so all of the time collects the same. So like it all goes towards your retirement, but all the same benefits, all the same. You have a 401k system. You have life insurance, you have all these things. But in the experiences of learning all the different industries, it really makes a person, the commodity of knowledge is enormous. And people seek after that because there's probably not a lot of people out there that know about the food industry or healthcare or the Joint Commission or the Department of Energy or the Department of Defense. And in that aspect, you meet and network so many people, and the opportunities just really are helpful, as well as just learning, different types of environments, and people come from all walks of life. And it's really been a great experience to I came from very humble beginnings, and I've done pretty well for myself. So I would encourage students that are watching this, if I can do it, my parents, came from really humble beginnings, and I came from real humble beginnings. Anybody can do it. You can do it.
Good. Well, thank you so much. Is there anything else you'd like to add? Do you want to talk about the opportunities? I think we kind of touched on a little bit.
Absolutely, sure. I know I kind of went a little fast through some of them, but so the federal government, there's three opportunities I'm going to mention. There's probably more, but that I know of. The first one, which would be ideal for graduate students and recent graduates after that, is called the Presidential Management Fellow Program, or PMF. And it's a really competitive program for you have to have either a master's degree or a PhD, or in a program that you're about to graduate from. I think the application status, I think, is just opened. I think October 1st today, but it's like a fast track system for people that are interested to work for the feds. I believe, if not all, most federal agencies, all the ones I've listed, I think, as well as more, participate in the program. And it's a really great opportunity. Try to get your foot in the door, and in a couple of years you'll be, a GS 14 or a 15, and that's big money. That's a promising career. Any type of discipline they allow people to qualify for, I would suggest there's a website, and I think I had sent it to you, Rebecca. It's called www.pmf.org, and there's an entire application process. I would recommend review that, consider applying, and also maybe take a look, or maybe give career services on campus a call. There may be somebody on campus at Fresno State that may know more about it. I'm not sure. I wish I would have known about this program when I started. It's quite prestigious. You get to come to Washington, you meet congressmen and senators, and I think you get to go to the White House, and you get like 10 to 10. Don't quote me on this, but I think you get like $10,000 or $20,000 a year for training, and I mean, it's quite good. It's a very prestigious and competitive program, but I think Fresno State students should go for it. It's a great opportunity. There's two other programs. I'll be brief on those. There is another one called the Pathways Program. You don't have to have a master's degree for that one, but it is an option to get in. That's actually how I got into the government. It is a similar program to the Pathways Program. That one you can learn about, I believe, on opm.gov, which is the Office of Personnel Management. And I believe they have a section that talks about internships or other opportunities to try to get in. The VA also has a similar program that kind of piggybacks on the Pathways Program. It's called the TCF program, the Technical Career Field Internship Program. And it covers all varieties of different occupations that public health students or recent graduates could pursue. And many other agencies have these programs as well as Congress. It's just, I think, just trying to get the information out there to the students. But if you want to work for the government and you're willing to move, the sky's the limit. There are opportunities in the Central Valley. I'm proof of that. I made it happen, and if I can do it, anybody can. But that's what I would suggest. Consider those three programs. And I sent Rebecca those links. So hopefully, definitely take a look, and yeah.
And if anyone has any questions, is it possible for them to reach out to you? If they
Sure.
Yeah.
No problem. I think I can provide you my information, so you can post it for those that are interested to contact me. Sure, be more than happy to help. If people have questions about the federal government or anything, I'd be gladly email them. That's fine.
Wonderful. Thank you so much, Joe. Thank
Sure.
you for your time.